Our new patient experience, I would tell you, is second to none. When you first call the practice, that's when it starts. You're going to be greeted by an amazing front office coordinator who will make you feel very, very comfortable, find out about your needs, and in the mail you're going to get an amazing packet describing everything that our practice does. And the focus is to make sure that you feel comfortable as a patient. We want to encourage you to ask as many questions as possible. You walk into the office, you're going to be greeted by our wonderful front office, and you're going to get a tour through the office. And the reason for that tour is so that you can get situated and know exactly where things are. Simple things like, here's the restroom. We want our patients to know. We're going to show you what our practice does differently. We're going to show you the technology that we have. You're going to get a tour around the office so that we can show you things. Now, what technology do we have? We have CT scans. Now, what a CT scan is, it gives you a three-dimensional reconstruction of your face, of your jawbones. Why is that important? If we're doing any type of surgery, we need to know where the bone is, we need to know where the nerves are, we need to know where the blood vessels are, so that we can do surgery safely for you. The second thing we have is we have something called a face scanner, which very few practices have. And what a face scanner is, it's an advanced camera which scans your face. And how does that help us? If you're having a full mouth reconstruction or a smile makeover, the teeth have to look good in your face. You may have seen your friends or colleagues or people that have had makeovers done where the teeth are kind of slanted at an angle, or they're not straight, or they don't look correct in the patient's face. So this is an added tool that we use to ensure that when we deliver the final smile makeover, we deliver the veneers, they look good in the patient's face. The third piece of technology that you're going to see is something called an intraoral scanner. Essentially what this is like a wand, it's like a camera where we scan in the patient's mouth and you get a 3D image of your teeth on a screen. Now this replaces the traditional, for lack of a better word, the goop that you get in your mouth, the impression material in the trays where you're almost choking. We don't have to do that anymore. We have impression-less technology which can provide predictable results. The next thing that you're going to see are 3D printers. And 3D printers are amazing tools in dentistry where we can provide things like night guards and partials very, very predictably. So once we've toured you through the office, you're going to meet one of our treatment or patient concierges. And our patient concierges put you at the forefront. Their interest is to ensure that you are comfortable and that they can answer all of your questions. Their sole focus is to ensure that they can take you through your treatment process predictably and to be able to navigate all the obstacles that might come in your way. Now, once you've got to know our patient concierges, you're going to be in the treatment room. One of our dental assistants is going to come in. They may take some photographs, they may take some x-rays, they may take a scan of your mouth, of your face, and even a CT scan. And the reason we do all of this is to ensure that we have as much information as possible so that we can make the right decisions for you. Diagnosis is critical so that we can render the appropriate treatment which is individualized to you. And when patients are sitting in the chair, one of our doctors, one of our specialists may walk in and talk to you about what your treatment needs entail. And the things that patients normally ask and what we like to address is, how long is this going to take, right? Is this going to hurt? Is this going to last a long time? Is it going to last forever? And finally, they ask you, your concern would be that how much is this all going to cost? Because quality dentistry is a significant investment in your health. So let's start with how long it's going to take. We try to make things as efficient as possible. We try to utilize all of the technology we have in the office to shorten your treatment time and reduce the number of visits for you. The second thing, is it going to hurt? There are many ways we can do the dentistry. We have on-site anesthesiologists so that if you choose, you can be asleep throughout the whole procedure, right? Is there going to be a little bit of, discomfort here and there? Maybe, maybe not, but I can tell you, out of the thousands of patients we've seen, we usually give them a scale of 1 to 10, 1 being no pain, 10 being excruciating pain. Most of them say about a 2, maybe a 3. So most of our patients are quite happy, and we try to do it as painlessly as possible. The third question is, does it last forever? I've been in the world to know that nothing lasts forever, right? When you put a significant investment in your health, we want you to feel comfortable that should something happen, we will take care of it. So we do warranty what we do. So our implants have a minimum warranty of 5 years. Now, why do we say 5 years? Most of the research will tell you that if the implants pass the first 5 years of service and you look after them, those implants should be within your mouth for the rest of your days. The teeth on top, we provide you a minimum warranty of 7 to 10 years. Now, these warranties are based on 2 things. One, that you come back to see our hygienist so that we can help you clean what you have in your mouth. We want this to work as much as you do. We want it to last as long as you do, right? So you have to come to see the hygienist at an interval which we determine for you. And the second thing is you wear a night guard. A lot of patients, they grind their teeth at night and they can put a lot of force on their teeth. And when you put a lot of force on your teeth, teeth can break, right? So providing you wear that night guard and providing that you come back to our hygienist for cleanings, we do warranty what we do. Elephant in the room is, how much is all this going to cost? And patients often worry about the costs. The question I put to patients is, what would happen if you did nothing? Say you had a missing front tooth, you couldn't chew your best. What would be the cost of doing nothing? And you have to think about that for a second. The cost of doing nothing is actually a lot more than the cost of the procedure. Now, despite that, physically it will cost something. So patients often ask us, how much is my insurance going to cover? What are our payments? How much is this all going to cost? So dental insurance, we will help you maximize your dental insurance. You should know that dental insurance have a limit per year. Some dental insurances cover $1,000 a year, some of them cover $2,000 a year. Our patient concierges will help you maximize your dollar benefit. Now, how can we help patients pay for treatment? We do have third-party financing companies which allow you to split the payment up over a period of time and have a payment which is comfortable for you. Once again, our amazingly talented patient concierges, their job is to find something that is comfortable for you to allow you to progress with treatment. There are many ways we can break treatment up. We can break it into monthly payments. We can break it into phases whereby you have phase 1 done, disease control, phase 2, and then phase 3. Our goal is to help you get through the treatment process, predictably. Now, once we've decided on a treatment option for you, there's never one way to do things. You're going to get multiple options, and you'll get a minimum of 3 options, and our dentists, our specialists will help you decide what is best for you. Now, once you have decided on what's best for you, we will plan the appointments in such a way that we maximize your time, we maximize the efficiency, and we help you get from point A to point Z as efficiently as possible. I am 100% confident that my team will make you feel very, very comfortable and allow you to get the dentistry that you deserve and that you want in a predictable way and in and from a financial perspective in a way that you're able to afford on a monthly basis.